This is Steve Zeltzer with Workweek. And one of the critical questions in this pandemic, the defense of the people of this country and the world, is the role of healthcare workers and the fight of healthcare workers to not only take care of their patients, but also to protect themselves. And that has been an ongoing struggle with nurses in this country, and particularly the struggle of the California Nurses Association, National Nurses Union. And joining us today is Deborah Burger. She's a co-president of CNA NNU. So I think she's one of the founders of the National Nurses Union, and also has been an active participant in the fight for national health care in the United States. And I think that may be one of the lessons we've learned about this crisis, public health care, and why that's critical. So welcome to Workweek, Deborah.
Thank you. It's a pleasure to be joining in by Zoom.
Okay, so the fight of the nurses to have protection and to be prepared is not just with COVID-19, but actually during the Ebola struggle. I attended a press conference at UC San Francisco where nurses there were concerned about not having PPE at that time, and warning the public, warning other healthcare workers that this is a vital question. So maybe you can talk about the role of National Nurses Union in to prepare your members and all healthcare workers and the public about what is needed in this crisis.
Well, you are correct. Our fight to get personal protective equipment didn't start with this pandemic. It did start with SARS, H1N1, and then, of course, the Ebola epidemic. And it was because there was a lack of political will on the part of our employers and politicians to really step up to the plate and make sure that healthcare workers were protected, that we filled that void. And it's unfortunate that we had to do that because our politicians are elected officials that really should be stepping up to the plate to provide worker protections. And the fact that we couldn't rely on then the CDC, we couldn't rely on then the World Health Organization, and we couldn't rely on then the legislative process or our employers. And it's repeated. In California, we thought we had really addressed the issue because we got the first ever aerosol transmissible disease protections in California that were the strongest in the nation. And they were set to be implemented by President Obama and his administration. That was taken up at the end of his administration when President Trump won. Those protections that were going to be implemented, that were the model from California, ended up being put to the wayside. We were told they weren't necessary. Little did we know that how important those protections would be in today's fight. If we'd had those protections in place, a lot of what we're going through now, nurses dying from the COVID-19 and becoming infected, wouldn't have happened if we'd had the personal protective equipment that we knew we needed then in place. And the other thing that's highlighted in this epidemic is the severe lack of funding for a real public health care system and the severe lack of funding for a public health system, right? Many states during the Great Recession of 2008 cut their public health systems, and now we're paying the price for that as well.
And of course, your members warned, and I was at that rally with Ebola, that the hospital was not prepared for protection, PPE, having masks and that kind of thing. And why don't we talk about a system that doesn't prepare for what is expected to come, which are these virus outbreaks. I mean, it sounds bizarre, and why is that? Why aren't the hospitals preparing when they know that this is likely to come?
And that's probably the $10 million question, and nurses know the answer to that. The real answer to why employers aren't prepared for this epidemic or any other surge in case of a flood, a hurricane, or any other kind of massive trauma is the fact that the hospital industry adopted from the auto industry and other manufacturing industries the just-in-time supply side providing for resources, not only for staff, but for equipment. So when this pandemic exploded, hospitals did not have reserves of personal protective equipment. And we very quickly found out that states also subscribed to that supply just-in-time demand and also did not have the stocks that we needed in those massive numbers. And it doesn't make money to have the supplies that we need. And unfortunately, what we've seen is that hospitals are okay with putting healthcare workers' lives at risk and their health to save money on personal protective equipment.
And your members were concerned particularly about the CDC regulations, which lowered the standards and allowed hospitals in California to reuse their masks. Why don't you talk about that whole controversy and the idea of reusing masks and your opposition to that?
Okay. The reuse and decontamination of the masks is an issue that is a myth. If you go to any website of a manufacturer of masks, they clearly state it is a one-time use mask. Our employers, through the American Hospital Association, came up with a grand scheme to decontaminate masks. They don't say sterilize, they say decontaminate masks and reuse them. The studies that they used to back up their claim that they could safely decontaminate these masks, when you actually read them, they only used a small portion of this multi-formed patterned, complex patterned mask. When they did the studies and decontaminated them and tested to see if the viruses were still alive, it was a small part. What they didn't look at was the elastic bands that hold the mask on, the shape of the mask, the filtration capability, and the ability of the mask to form a seal around the face, which are the mechanics that work on these masks. And so when you read those studies, it's really clear that even they know that those processes probably don't work. And when you look at the hydrogen peroxide method, I think that's the Batali method, hydrogen peroxide is a toxic chemical. We use it a lot in our own households, but it is toxic. And if you breathe it, there are harmful consequences of breathing in those hydrogen peroxide vapors. And they aren't able to state clearly how long those masks need to be aired out before you can use them. And it's even more difficult because hydrogen peroxide has no odor. It is odorless. And so having those concerns, we feel that we can't, in all good consciousness, recommend reuse of masks. And in fact, we tell our nurses to make sure that they insist on a clean mask. And reuse of a mask is unconscionable because there's the possibility of contaminating your mucous membranes with the outside of these masks when you are taking them on and putting them off.
Well, when we saw this outbreak in China, Wuhan, we saw that a lot of the healthcare workers were all masked up. They had PPE, completely enveloped in PPE. And this was not just the case in China, in Korea, in Taiwan. In Korea, no medical nurse represented by the union, I understand, has died. So this argument that we didn't know what was coming, when in fact it happened in China, they warned people that this was coming, and Taiwan and Korea were able to protect their medical personnel. How could that be? I mean, Americans ask, how can these other countries do it, and yet the United States is unable to protect its nurses, its frontline healthcare workers?
The United States is the richest country on the planet. And it is disingenuous and lying for them to say that they cannot afford to have these protections. We have been in this fight from January through, this is almost the end of May. So quite some time. And for the politicians and for our federal government to say that they can't manufacture these masks, when we look at every single other country. Canada had its first death from the COVID virus of a registered nurse just this last week, one death. And Spain, through its fight with inordinately large numbers of critically ill patients, had 4 deaths. And what we've been able to find in the United States is that we have over 100 registered nurses that have died as a result of this epidemic. And those are the only ones that we have been able to find. And that is the other sad tragedy, is that no one is tracking the data. No one is tracking how many registered nurses and healthcare workers are getting ill from this. And it's almost because they don't want people to know, because that means they're culpable for providing us less than optimal personal protective gear. Because as you pointed out, when you look internationally, you see healthcare workers in other countries that are completely covered and sealed off from the virus when they go in to provide care to these patients. That is not the case in the United States. When we did our third survey, we still showed that over 84% of the nurses haven't been tested, and the number of nurses that are reusing their equipment is up to 87% of the nurses are being forced to reuse single-use masks. There's nowhere on the planet that you would ever even want to consider reusing any number of products that I could think of, just for a safety reason.
Well, one question is, California had under Cal OSHA these protections. Why were they waived or lowered to accept the CDC standards?
The reason they got lowered in California was our employers kept insisting that they were following the CDC guidelines. And as you know, the CDC guidelines were changed almost daily to go along with not science and why we should be changing these guidelines, but for purported shortages of supplies. And that relied on the employer reporting that they had shortages. They didn't have to document it anywhere. They just had to report it, and the CDC says, oh, okay. So we actually were able to force California's hospitals to follow the guidelines until the CDC finally came out with a recommendation that if you don't have the cap or PAPR system, you don't have N95 masks, you don't have surgical masks, you don't have procedure masks, you can use a bandana and a scarf. So when that happened, then California, unfortunately, went with the CDC guidelines. And we believe that nurses were put at risk and in harm's way as a result.
And one of the concerns that healthcare workers have is speaking out. And of course, if you're in a union like the NNU-CNA, you have some protection. But nurses and healthcare workers have been retaliated against. Why don't you talk about this whole situation of intimidation, coercion for nurses and healthcare workers not to speak out, and what that means not only to healthcare workers, but to the public?
Nurses are speaking out because they know that the public health is at risk, right? When nurses aren't protected, our patients are protected, and we can transmit that disease to our communities, to our families and friends. And so that is an issue. And so nurses have been on the front lines speaking up forcefully and protesting the lack of PPE and the lack of supply, and have actually been terminated. We had nurses that were put out on discipline. They were suspended, they were terminated, and yet they still were speaking out for public health and their patients. And because of the public supporting registered nurses in this country and in the community, we were able to get the nurses back on the job and embarrass the employers for their egregious behavior, when all we are trying to do is make sure that we are protected so our communities are protected. And the harassment has not gone away. They're still intimidating nurses in many communities. And when you look at the survey results, where 87% of the nurses are having to reuse masks and decontaminated masks, that tells you that there are nurses that don't feel that they can insist on a fresh mask when they need it.
And the firing of workers, particularly healthcare workers who are trying to protect themselves, their families, and the patients and the public, is also, connected to what happened in Highland Hospital, where the Saber Alawi, a nurse, put on a garbage bag because he was not getting any PPE, and then it was on a Facebook page, and then he was terminated by the management, private management of Highland Hospital. Do you think it should be a criminal offense to terminate somebody who's trying to protect their health and safety? I mean, his wife had cancer. He was very much concerned that he was going to kill his wife if he continued to work without proper PPE.
Well, and the point of nurses advocating for the PPE and to the point of termination is so that we can safely provide care and not infect our families. And in fact, some nurses are going to great lengths to make sure that they don't infect their patients by staying in a separate bedroom or a separate part of the house, or getting a hotel room or an Airbnb room for the times that they're caring for their patients. And to have the employer threaten you during this time is really immoral, because we're not doing it because we don't want to take care of these patients. We do want to take care of them, but we want to take care of them safely. So we do have some legislation, both nationally and in California, to improve workers' safety during times like these. And it's not just nurses. When you look at the meat packing industry and the nursing home care industry that are making huge profits, yet they can't provide a safe working place for people that are providing for us, that are deemed essential services, should be criminalized.
And the other issue is inspections. I know San Francisco General, the healthcare workers there have filed health and safety complaints because they've been retaliated against because they didn't have masks, frontline workers. Yet Cal OSHA apparently is not making any physical inspections. There are less than 200 inspectors in Cal OSHA for 18 million workers. It seems like there's basically really no government oversight or OSHA oversight of workplaces for workers in this dire life and death situation.
It is unfortunate that Cal OSHA is severely underfunded. Even in good times, it was deemed that that wasn't a priority, both in our state and nationally. When you look at all of the public health systems that protect the public, including the regulatory bodies like Cal OSHA that protect workers, those are not seen as something that is valuable to society. And now we're seeing the effects of that with the meatpacking plants and the nursing homes. We're seeing the value that these departments make for us when we depend on them to protect us and our lives.
Well, have there been any Cal OSHA physical inspections of sites that CNA represents, the nurses?
Actually, I'm not aware of that, so
okay.
I couldn't really comment on that. Can I stop this for a second?
Sure, yeah.
Okay, I'll be right back.
Okay, no problem. Okay, good. So the other issue is testing. And of course, President Trump says everyone can get a test. Everyone's going to get a test. And we don't have to worry about that. There are lots of tests. Other countries, again, like Korea and others, have done massive testing and tracking. What is the situation? Because if people don't get tested and they communicate the disease to other people, and it makes it impossible. And even these workers, for example, at Tesla opened up without any testing of the workers. They went back to work, and the Tesla workers live all over Northern California, even the Central Valley. So if they do have it, and it is communicated in that plant, they'll end up, spreading it throughout, Northern California and the Central Valley. What kind of effort has been to make testing available? Have all the nurses been able to get tested so they themselves know whether or not they're infected?
Well, that is another issue. Testing and contact tracing has been an ongoing problem. There are some states that realize that that is a priority, California, New York, New Jersey, but the problem is still the availability of testing and the follow-up, because you get a positive result, but then what do you do with that information? You need to follow up on it. So it's not just the testing. That helps you plan for your life and your result, but as far as preventing the disease, the contact tracing is key. And we've seen that play out in many, many facilities. In Orange County, there was a patient that was admitted to a hospital, wasn't tested, wasn't designated a COVID patient or a patient under investigation. And that one patient exposed at least 10 or more people, not only to the virus, but then those nurses tested positive for the COVID-19. One patient exposed that number of nurses and healthcare workers. UC Davis was another case where it was a known patient that was coming in, but they hadn't notified the staff when the patient came in. And out of that one patient, there were 134 healthcare workers that were exposed. And so, and tested positive. So the testing is key because it helps you quarantine people in place so that they don't spread the disease. It allows you to understand what communities are at risk. If we had contact tracing in nursing homes, that would be helpful. And in the workplace, as you point out, when there are these cases for reopening the economy, we really do need to be wary of how we're doing it so that we don't have another surge in the disease.
And what do you think about this ideological campaign by Trump and by others that we need to liberate ourselves, we should just open up, and this is all a conspiracy, this whole virus, and that people really shouldn't wear masks even today. Yesterday he went to a plant and he didn't want a picture taken of him with a mask. I mean, what do you make of that? And what does that say to the American people about what is happening in this country?
Well, there's many levels of concern with the Trump administration and the inability to have a clear, accurate, concise message on the use of masks, the quarantining, whether the virus is real or not. We keep having these discussions from the White House and his cabinet members and family about whether the virus is even real or not. And it would be really helpful if we had, at the highest levels of our government, people that actually followed the science and utilized it properly. And it's really concerning when the message to the American public is it's patriotic to go out and put yourself in harm's way to reopen businesses. We want you to go out and start consuming again, even if it costs you your life. It's worth it to get the economy back. And it's extremely frustrating for healthcare workers to see this, because we work so hard day and night to keep people alive and to take care of them and keep them out of harm's way. And then we have a federal government that just says, have at it, don't take any protections, which makes our job even harder. It's incredibly frustrating to know that we don't have the leadership that we should to keep us safe.
And of course, in Brazil, Bolsonaro, and it sounds like it's criminally reckless to tell people they can just go out and liberate, so you don't have to follow any kind of health standards in the midst of this pandemic, which is killing people all over the world.
It is extremely frustrating. Before this pandemic, we had done multiple country visits of their healthcare systems. And we were fortunate enough to be able to go to Taiwan and to Canada and to Cuba to see how they provide healthcare for their citizens, because they have single payer systems. And Taiwan was strikingly positive in that they had recently, in 1997, enacted a Medicare for All system there. And the ability to get the message out to their communities when there was an emergency or when they needed to take care of an outbreak of flu or something like that was really stunning and very humanistic. It was really heartwarming to see how much people really cared about each other and their health. And then to come back to the United States and start going through this and see the total disregard for the citizens and their safety is the polar opposite, and truly, truly heartbreaking for nurses throughout the country.
And even in Cuba, which is a poor country, I mean, they have nothing, yet they're able to protect their people, and they're sending doctors and nurses to other countries. It sounds, how could that be when we're in the state that we're in?
Well, it is possible, and I would not have believed it if I hadn't seen such a poor country doing so much good work to provide housing for everyone, to provide healthcare for everyone, to provide education for everyone. But it was a matter of political will and putting the priorities in place. All of the buildings in Cuba were not the tip-top, well-kept buildings. There were buildings that went by the wayside and they left them vacant, but their priority was housing. We never saw one person, not one person, homeless. All of the kids were in school. They all had an education. And it's a very, a society that does have a good education system and a healthcare system that really does care about the health of its people. And the United States could do that too. We could do that. But our priorities are not to take care of our people and keep them healthy. Our priority is the market and the economy, and that's unfortunate.
And of course, your union has been a leader in the fight for Medicare for all, for a national healthcare system that would, in the face of mass unemployment, just heard that there may be 25% unemployment in California. There are 40 million people now who've lost their jobs in the United States. And of course, as you know, when you lose your job, you lose your healthcare for many people. So it would seem that the Medicare for all and national healthcare should be on the front burner as far as action in the United States to protect all these people who've lost their jobs.
We absolutely do believe that Medicare for all should be on the front burner. Just a few months ago, there was all this talk about all of these unions saying that they had wonderful benefits and wonderful healthcare systems, and they appreciated it, and they didn't want Medicare for all. And now those union members don't have jobs. They don't have health care. And so it only reinforces what we've been saying all along, that it is ludicrous to tie healthcare to an employment status. And now we're seeing the folly of that decision put right in front of our face. And I'm hoping that people see that the nurses in this country were right all along, and that there will be a priority to improve our healthcare system and not feed a health insurance industry, but rather feed a healthcare system.
And another issue that we've seen in this pandemic is that hospitals eliminated elective surgery in order to deal with the influx of people who had COVID. And that has created now a situation where hospitals are going bankrupt. You have a situation where Seton Medical Center was taken over by the state, and you have a situation, a chaotic situation, as far as we need hospitals, we need health care, yet it seems it has to be profitable to exist. in California and other states. That doesn't look good for the future of healthcare in this country with the present setup.
Well, you're absolutely right about having a for-profit healthcare industry and having a for-profit hospital industry. The priorities are not similar, right? For Medicare for all, everybody gets the care that they need. For a hospital industry, it's everybody gets the care that we decide they need as long as we can make money. And not only was Seton affected by this, but St. Vincent's Hospital that was in downtown LA was shut down the week before we had the shelter in place because of this crisis. A busy inner city hospital was shut down. And it wasn't that they weren't making any money. It was that they were not making enough money. And we have to look at that and say, how much money is enough? What kind of profit should be allowed for these hospital systems when we know that when they're making money, they're obviously denying care to patients that need it. That's the only way you can make money, when you're taking in premiums and co-pays and those kinds of things, yet they're making billions of dollars in profit. How are they making that? And if they're making $7 billion in profit, like Kaiser did last year in 2019, where did that money come from, and what care was denied in order for them to make those profits? And that's a not-for-profit system.
Well, the Kaiser Chain Foundation and also the union, SEIU, what was the SEIU and Kaiser, UHCIU,
Yeah.
both united against Medicare for all in California. There was a bill in California. So why don't you talk about your effort to get healthcare and the obstacles you faced in California, where, according to surveys, the majority of people in California would like that system?
Well, there's a lot of opposition to Medicare for all, and it comes from the hospital industry. But even the hospital industry does have their allies that actually help the hospital industry make sure that healthcare reforms fail. And unfortunately, the hospital industry seeds money out into the community. They give money to community groups. They give money to organizations to support them. And then in return, they ask for their support in thwarting legislation to have Medicare for all on a state level or a national level. And some of the unions cooperate with the employer to make our efforts fail. And it's unfortunate because the union members don't always realize that this is happening. And those members are also being harmed by lack of a real healthcare system that focuses on delivering care.
And on May Day, you had rallies all over the country to raise this issue of healthcare with workers around the world in this COVID fight for survival, really, of working people, of the public. Where do you see this taking the labor movement as a whole? Because the national AFL-CIO has not demanded that there be Medicare for all. It seems like this is an emergency situation now, because it may even come back again in the fall. The healthcare system is really in a shambles. You're having hospitals going bankrupt. I mean, it seems like the situation has actually deteriorated even much more because of the pandemic and the inability of our system to organize the protection of healthcare workers, the patients, and the public?
Well, there's several pieces to that whole question that you just asked. You talked about Medicare for All and the AFL-CIO's position, and then you also talked about the hospitals being in a shambles and bankrupting. The thing that you want to remember with these hospitals that are going bankrupt is that they don't always go out of business. They go bankrupt so they can get out of debt and leave their creditors in the lurch, but they do manage through hedge funds, sell that valuable asset, and then those hedge funds go into the business of providing hospital care, which should be scaring the pants off of people when you have a hedge fund running a hospital, right? And then the AFL-CIO, they do have they have a support position for Medicare for All. And I think that now a lot of the unions may see the value in having Medicare for All because they have really seen what's behind the curtain in this hospital industry the way we have it now, and with what our employers are doing, because they are going to be cutting benefits, they're going to be cutting pay, they're going to be laying off people. And so now, with this economy as dire as it is, I am really hopeful that there will be some positive change for workers in this country, but it'll only be because union leaders are going to have to step up to the plate and insist on what's good for the entire community, not just for their union. And we would love to work with the unions to improve and expand Medicare to include everyone in this country when it is going to be a dire need. We can't have people going bankrupt as a result of medical bills. And it's not just COVID. Cancer still strikes. People still have heart attacks. People still get Parkinson's disease. People are still in automobile accidents. So we do have a need for healthcare, and we need to make sure that people at this time are able to have the healthcare they need.
And we have this situation now where the government, hyperspeed, they're going to have vaccines. And he's promised that we're going to have vaccines in this country. And they're already giving billions of dollars to drug companies for unproven vaccines. This whole situation of big pharma and the drug industry being responsible to protect the public, and basically they want to limit liability for companies so that they're not responsible if somebody dies from it, either a worker who's ordered to go back into a plant, a meat plant or a Tesla plant or an auto plant, or workers who take these vaccines. And they're saying the Army is going to distribute now the vaccines. And the right-wingers are saying, you know, Trump has been taken over by the right wing now, big pharma. You know, they're having a military insert vaccines in people. I mean, the whole thing seems, and then attacking the WHO, the World Health Organization, the whole thing seems like bizarro about where the drug industry is, what role it plays in our society, that we're going to rely on these drug companies and their profiteering to protect us, the people of the United States?
You're exactly right to be concerned about the pharmacy industry, big pharma. We've seen it play over and over and over again, both with the opioid epidemic, with the severe shortage of necessary medications, the severe shortage of IV solutions, because they also follow the just-in-time supply side of preparing for any kind of disaster. They don't have stockpiles. And in fact, the biggest example was during Hurricane Maria, when Puerto Rico was slammed and rendered inoperable. There was a big manufacturing plant in Puerto Rico for IV solutions, for normal saline and lactated ringers. When that company was put out of business because of the hurricane, there was a global shortage. And why was that? Because it didn't make sense to have 1 or 2 or 3 or 4 plants making that. They could do it in one plant, and we paid the price for that. In the opioid epidemic, the pharmacy industry was allowed to market all of these dangerous drugs and tell them that, you know, they were better than the current drugs because they weren't habit forming. And then turns out they were even more habit forming and had lethal repercussions for families all over this country and all over the globe. But it was a way to make money, right? And so
they were profiteering on death.
Yeah, and so these are the people that are going to be put in charge of developing these drugs, and the Congress is going to waive liability not only for the pharmaceutical industry, but for all these other industries like the meat packing plants and the hospital industry that aren't providing safe environments for workers. And so all of these industries have protections, but the workers themselves don't. And that should tell us that something is very, very, very wrong.
And the solution, because the pharmaceutical industry, like the hospital industry, has spent a lot of money and organized national effort to prevent Medicare for all, to prevent any kind of rational healthcare system. Do you see that changing? I
don't see it changing, that the pharmaceutical industry is going to just all of a sudden come on board for Medicare for all. It's our job as nurses and citizens to make sure that our politicians have a backbone. So we'll be knitting backbones for all of our politicians to actually come on board and do the right thing, because we're the ones that vote them in. And if they kill off their voters, then that system is gone, and we can vote them out. So I think that with changing the political climate and changing their perception of what's at stake, if they think they could lose their seat in Congress or in the state level, then they'll change. But you know, there's a ways to go, but we are changing minds. When you look at the polls, over 80% of Americans on the face of it support Medicare for all. And probably that's changed even more now with this pandemic.
The political framework, you have the Democrats and Republicans, both of those parties take money from these billionaires and from the industries. There is no Labor Party in the United States. So it seems like there's a political vacuum for a program to really change the whole political dynamic in this country. You think that is going to change?
No. I've been around a registered nurse for over 45 years, and I've seen some really good work done by third parties. I was part of the founding convention for the Labor Party at one point. But the way the system is stacked by the incumbents, when you look at the Republican Party and the Democratic Party, they're pretty tight, right? They're just like right there. And so it really would take a revolution to change that, because even the Green Party is looked at as sort of a fringe, unfortunately. And Bernie who's been an independent, ran on the Democratic ticket because he knew that there was really no way to become a third party candidate in this country. It takes a lot of money. And when we had Ross Perot running that one time,
they wouldn't even let him in the debates. Ross Perot was kept out of the debates. So it's a rigged kind of political
so was
system.
Ralph Nader. So was Ralph Nader.
That's right.
And so the political system right now is still rigged, but we can change the politicians. We have progressive candidates that have won. And how is it that having access to health care and a college education and a safe place to live and a safe community, those are radical ideas? I mean, those should be the bedrock of any society, but here in the United States, those are radical ideas. But even having said that, those radical ideas are taking hold. They're getting traction with the American public because of the desperate times people have been in since 2008, with all of the austerity measures in this country, and now with this pandemic. It's opening people's eyes to what's really at stake in this country.
And we're going into a major depression, it looks like. So the question of food, the question of survival for 40, 50 million people is the question now. How are people going to survive in this system that is based on profit, private ownership of everything?
Right. And President Trump is still trying to get rid of our postal system. It's like, what? Well, the one thing that works, and we're going to try to get rid of it and sell it off. And I was talking to a reporter earlier today about, where do we go from here? We're opening up the economy, but the virus hasn't gone away. And in California, what about the fire season that will be coming in the next few months, and these power outages, and how are we going to deal with social distancing, because the virus is still here, right? It's still here. So that, I hadn't even put that into my radar screen yet, but that's another issue that we're going to have to be looking at, and it sometimes feels overwhelming.
I mean, the climate, the economic crisis, the pandemic, and the climate crisis together now face a real problem for the future of humanity, really. I mean, I think that's what we're looking at today.
Exactly. And so with all of this happening, I think that we really do need to look at where we are at a society, and who do we bail out? Are we going to give billions of dollars more to corporations? They could have just mailed out $1 million to every single citizen in the US instead of giving it to all of these corporations. And we probably would have been better off, because people that get that money are going to be spending it on their families. They're going to be spending it on groceries. They're going to be spending it on shelter and education. So we would have been better. But what did we get? A $1,200 check that won't even cover rent in most cities in California for 1 month.
And now with McConnell saying there's going to be no more money unless threatening that cities and states have to go bankrupt, that they're attacking the pensions of public workers. I mean, this is going to be catastrophic. The mass layoffs of public workers, frontline workers, healthcare workers in public agencies, along with the post office. It seems like it's a real confrontational situation for working people in this country.
Well, it actually makes no sense to put everybody through the pain of a bankruptcy, the real lives that will be lost from that. And when they can prevent it, the federal government can come up with the money to prevent these bankruptcies in these states. I mean, California's now got a huge deficit, but it was because they did the right thing and worked to make sure that Californians were protected. And now we want to penalize these states for doing the right thing. It's just not a humane government at this point on the federal level. And it's really tragic that there isn't an FDR type person that's in charge of the government at this time, because the government could be doing so much more to help workers and the people in this country that are at risk of losing everything.
Well, in California, we have 170 billionaires. There's 74 billionaires in San Francisco alone.
Oh, know that.
Shouldn't there be we can rely on the federal government. Can we rely on the federal government? Why shouldn't we have a billionaires tax on the wealthy in California to make up for these deficits, massive deficits, which are coming in the state?
Isn't that part of that because they can move? They can move out of California. But
well, you can put a tax on their property. They have a lot of homes.
Oh yeah, there is that.
Elon Musk has 5 mansions, which I understand he's selling.
In California?
Yes, 5 mansions, which I understand he's selling because he's worried of a housing price collapse in the economy. So he's dumping all his property. But there's a lot of wealth in California, and we can wait for O'Connell and the national government to come through. But I do think with all the wealth in California, the people of California have to look at that as far as who's going to pay for this crisis.
Well, I think that you're absolutely correct. There is a lot of wealth in California. There's a lot of wealth in this country that is almost to an obscene level. When you have one person that could end up being the first trillionaire, some countries don't even have that kind of wealth. And so we really do have to look at a fair taxation system, because up until recently, it's been the workers of this country that have been footing all the bills. The corporations and the wealthy have not been paying their fair share. There's some billionaires that pay less taxes than some of the healthcare workers in this country.
Bezos has tax deductions.
And so how is that fair to workers in this country that we're sharing the lion's share of the burden? I've seen many charts and graphs that have shown the amount of money that rich people are paying has dropped significantly, and the amount of taxes that workers have paid has gone up significantly. And that's really not fair. In a country like this, everybody should be paying their fair share. And most people think everybody is, but they're not. Okay, well, I want to thank you very much for joining us on Work Week. We've been talking with Deborah Burger, who is one of the co-chairs of the president. You can just say president. President, okay, president of CNA and NNU, and thanks for joining us. And I give my thoughts to the healthcare workers who are working so hard and even dying to protect the people of California and the people of this country. So thanks for joining us on Work Week. Thank you for the program. We appreciate getting this important information out. It's key to everybody being successful in this fight. Thank you.
When nurses aren't safe, the patients aren't safe. When nurses aren't safe, the patients aren't safe.